Welcome to Pregnant Possibilities. I'm Jeanne Schumacher, co-founder of the Pregnancy Advantage, and my partner is Dr. Debra Shapiro, a board-certified OB-GYN. And today on our show, we're going to be talking with Laura Marks, who is a vegan doula. And we're going to be talking about plant-based pregnancies. So Laura Marks is a vegan of 35 years. She's a vegan childbirth educator and birth doula. And she's a massage therapist and does other body work. She does hypnotherapy for vegan births. And she had her own vegan birth in water with her son, who is now 24. So Laura, thank you so much for taking the time to be with me here today, or be with us today.
Thank you, guys. It's a pleasure again.
Thank you very much. It's great to see you.
Yes.
This is so exciting. It's always exciting for me to talk to people who have been vegan for a long time, because when you first became plant-based or vegan, there weren't too many, actually. I mean, there wasn't the amount of the variety of plant-based foods that are out, and you really had to make your own way. And I'm just very impressed by anyone who could do that. So
thank you. Thank you so much. And you're right. There were less of us, and the word plant-based wasn't even in the lexicon.
Right.
So we did make our own way and are stronger for it. And I'm delighted to be able to share my experience with the world, and especially around pregnancy, birth, postpartum.
Right. And so you are a vegan childbirth educator. I'm also very, very, very respectful of any kind of childbirth educator, because it's wonderful. And I always send patients to classes and recommended classes, and childbirth educators are just fabulous. But I haven't really heard about a vegan childbirth educator. Okay. So can you talk about what that is?
Yes. So I will educate anyone that wants information about childbirth. I teach hypnobirthing. I'm a hypnobirthing childbirth educator. And I also have, if somebody says, I don't want to do hypnobirthing, but can you help me prepare for my birth? And the answer is always yes. I would rather have someone have some preparation than no preparation. I'm not attached. I do specialize in people that want or are vegan or vegetarian or plant-based and all the above. And even if somebody says, I just became plant-based or vegan or even vegetarian a week before I found out I was pregnant, or I was dabbling in it and I want to eat more plant-based, or I want to really have more vegan meals. And one of the things that I do in my classes is I talk about nutrition. And I'm very clear that I'm not a nutritionist, but because of my long study in plant-based eating and in vegan eating, I feel that I have much to share with people, and I'm always looking at the evidence. So that's where I come from, and it's a full-on childbirth education program. Somebody doesn't have to take anything else.
That's fantastic. That's really, really wonderful. So now that there's COVID, are you doing any of this virtually?
Yes, I am doing virtual childbirth education, and with the rest of the childbirth educators around the world. I have not heard anybody that's doing in-person classes. Most parents feel much safer doing things virtually right now.
Right.
Yes.
Right. Fantastic. And we'll talk about how people can reach you toward the end of the half hour. But have you noticed when you talk about being, like, you said that people come to you and know who you are and know that you are vegan, plant-based, that you're open to that, and you really want to talk to people about that, about being plant-based. But have you ever had somebody who was absolutely not interested in veganism or vegetarianism, and they just wanted you as a doula or as a birth educator, and they kind of were giving you a little bit of pushback about that? Has that ever happened, or really not?
I teach many, many non-vegan, non-vegetarian, non-plant-based couples or mamas. And there is a little pushback, but I really listen. You know, my job as an educator, especially as a doula, is somebody who listens because, oh my goodness, don't get me started on women not being listened to. And that's why, especially, I send people to midwives and OBs that are very much focused on the evidence. And that crosses over into evidence about how healthy a plant-based diet is and how healthy a vegan-based diet is. And if somebody says, I don't want to hear it, then I honor that, because the more we push back hard, then anybody, if somebody says, oh, vegan eating isn't healthy, then, that doesn't help us. So I dance with people. I very much do the dance and find out, what do we have in common? Because if somebody's an omnivore and they want to eat a lot of meat, or even if they're that keto meat person, I'll talk to them about what their overall diet is, and they must be eating some kind of fruits and vegetables. So we look at what we have in common.
Excellent. I love that when you talk about a dance with people, because that's a great image, because that's what you really are doing. And also when you do push against people, there's an equal and opposite pushback, and so you don't really get anywhere. And so thank you for that. That's a really great image. Absolutely. I was wondering if you must have had couples where the mom or one of them is plant-based and the other is not. Certainly, not to be heteronormative or anything. I mean, it could be any gender, and
yes.
But I just wondered if you'd seen that couples, and I don't even know what we call that when they're hetero.
So we just use the word omnivorous for the one that is not vegan or plant-based, and it has caused some, obviously, conflict, because they're talking about how they're going to raise their baby. How are they going to raise this child? What is it? And what is the support they can get from the omnivorous, from their partner who's not vegan or plant-based? How is the omnivorous person going to work with this? And how is their family? Because what support do they get? And is there any kind of negative things about how they're going to raise this baby? Because they're an adult, the mom is an adult, and if she says, I'm vegan or I'm plant-based and this is how I'm going to do this, and they've come to an understanding as a couple, yet what kind of attitude, what I see is the discussion around how they're raising the baby.
Right.
And so my degree is in psychology and counseling. So I often end up trying to help them navigate this piece about how are they raising baby.
We talk about that a lot in the Pregnancy Advantage, about family support, and not just for eating, but certainly that's extremely important, because moms, like, not only they need to be heard, but they need to feel that they're not hurting their babies, and to have somebody in the family, a mother-in-law or a mother or somebody else, sort of knocking them all the time. It goes on. You see this with breastfeeding too, when moms have trouble, and just all the input they get from other people about how they should be doing it and what they're doing wrong, and it can be very challenging.
It can, and I know you've seen this when couples or moms come to you, and I see it on a lot of listservs that I'm on that have vegan mamas and couples, and it hurts me because whoever it is in the family, whether it be the in-laws or their own parents, that say, I'm going to give your child animal products when you're not looking.
Right, and they do.
They do.
I've seen that also in some of these. Are they called listservs? Is that what it's like? Vegan websites?
Like Facebook groups or groups that are dedicated to vegan pregnancy and parenting. And yes.
And it's so distressing for moms to have to go through this, and they get on and make these long posts about, like, what should I do? My mother-in-law just threatened to give my child hot dog, or I mean, it's horrendous. And yeah, it's very, very hard. I was wondering, on the other hand, if you've seen, this would be interesting, have you seen couples where the non-pregnant person is vegan or vegetarian, and the pregnant person, usually a woman, it can be a trans woman, but the pregnant woman is an omnivore? I was just wondering if you've seen that go the other way.
I haven't had it personally, but I have seen it on the listserv, in these groups. I've seen a lot of different, but not personally any clients of mine. I have both sometimes I have both people in the couple want to go, like, they're not quite plant-based or not quite vegan, and they're on their journey and they want support. And how do they get that? And that's another thing. They don't want to be searching everywhere. They have so much to do. Mm-hmm. So to make things, to have places like, Pregnancy Advantage, where they can go to say, okay, let's look at this. They don't have to reinvent the wheel. And that's, I feel, the most important thing. And I'm sure you also, to make it the easiest things for people that we're working with.
Absolutely. One thing that we think about the Pregnancy Advantage is really for people before they get pregnant, for a number of reasons. But one is, and you could speak to this, it's easy for women to give up alcohol as soon as they're pregnant. That seems to be sort of an easy thing. And cigarettes, they can give it up. They're pregnant, they see a positive pregnancy test, out the door, right? They just crush the cigarettes and they're not going to smoke anymore, because that's sort of like, we've been told and we know. But to change the way you eat, everything that you put in your mouth is going to could possibly be a little bit different. Buying is different. The preparation is different. Everything, you're pooping, everything is different. I'm not sure you can do that so easily as soon as you see a positive pregnancy test. And I think that's why we designed this program, to really help women be able to do this before they get pregnant, not only for all the benefits because of all the epigenetics and cleaning out the toxins and losing the weight and getting to an optimum weight, but also because I think it's tricky to make all of these kinds of behavioral changes when you're dealing with a pregnancy and all the stresses of a pregnancy. So what do you think about that?
I think it's harder. I totally agree with you. And if we could do this just like health, we want to do prevention instead of, when somebody gets, so less treating the symptoms and more prevention. It's definitely a challenge. And that's where hypnosis comes in. Hypnosis can be very, very subtle and also incredibly elegant. And if we can find out their why is it that they want to do this? And if I like to connect the animals, I know that a lot of people are doing a vegan diet or plant-based diet health-wise, and of course it's a given to me. But if I can link animal suffering in, it lasts longer, and it's definitely an easier go-to if we pair that. So that's what I like to do, to give them a little bit more.
I agree. We don't talk about that so much in the Pregnancy Advantage, but certainly personally, because I'm also ethically vegan, those images that I have seen, and I know there are a lot of people who won't look at them, but then they also use that to keep eating animal products because they won't look at them. But if you do look at them, and you don't have to look at too many, but if you look at a few, you can smell meat, you can look at meat, and you can have it, your friends are eating it, and you don't crave it. You really don't, because of those images that are they're sort of burned into your head. And so you just kind of think about the animal and you can think about the suffering and you just don't want to eat it. But, and that whole, her name is Melanie Joy, and Carnism, her book is amazing, Carnism. And if people haven't seen it, Melanie Joy is fantastic. You can look her up on YouTube. She has a TED Talk, and it's really wonderful about Carnism. So I agree with you. I think it's a good motivator, but finding the why, and the why behind the why, like why do people really want to do this, and why might they want to do it when they're going to look to be, when they want to be pregnant, and when they are pregnant. It would be great.
And the other challenge, and this might have come up in your questions later, but I want to say that when their provider, when the pregnant person's provider is saying, you really ought to think about eating meat, or you ought to think about drinking milk in your pregnancy, or you ought to think about eating eggs. And when their provider is saying that as a, as a physician or a midwife, that's one of the trickiest things that I deal with my clients. And I don't know what your thoughts are.
Well, we talk about this. This is why the pregnancy advantage, again, is so important, because we're talking to people before they get pregnant. So they get to plan. It's all about planning. You get to look online, you get to interview, you get to go and have these talks with doctors and midwives and discuss how you want to be eating during your pregnancy and see if they're going to be supportive. You want them to be supportive, even if they are not personally plant-based. And there are places where you can look to find a plant-based doc, but there aren't that many plant-based OB-GYNs and midwives. But at least you want to find somebody who's not going to be outright hostile to you and try to undermine you. It's the same thing with your spouse. I mean, you have to come to an agreement. There are other countries in Europe where they're not really on board. I was just looking at the Belgium health services or something, and they are not on board with veganism. And I don't know if that has to do with their dairy industry. I don't really know. But, Canada, if you look at, first of all, I mean, you don't have to look any further than our own boundaries. The Academy of Nutrition and Dietetics has come out with a policy statement that says, and also our guidelines also say, that a very healthy diet is a plant-based diet, and it's healthy for all stages of life, from pregnancy, lactating, old age, athletes, all of it. So there should be no real legitimate concern if people are saying, well, I'm not going to take any vitamins, like I'm not going to take any B12, that's for sissies. Well, that's a problem, right? That's a problem.
Right.
So you have to be smart about it. And there are nutrients, and not just things that a vegan can't get from eating plant-based foods, but also just all kinds of nutrients that we need to be paying attention to in pregnancy. And that's another reason. But absolutely, you need to find a provider and a whole office, hopefully, that would be encouraging to you. That would really be wonderful, that everyone sees that not only are you doing something kind of a little unusual, but you're doing something wonderful for the planet, wonderful for animals, and wonderful for your baby and your grandchildren too. So that's what you really want. You want someone who understands what all this is really about.
Exactly. And also, afterwards, the pediatricians to, say to these mamas, well, if they can't, let's say, breastfeeding is best. And then sometimes it's a fight. The doc says, okay, it's 4 months, your child can have food. So that's a whole nother thing. And pressing formula in the United States, there's no vegan formula per se that I know about. I don't know if you have information differently, but that's a big topic in the discussion boards.
Oh, I had just heard of some. So, but we're just starting on the baby advantage. So I'll have to do more research, but I had just heard of, I thought there was.
There is. I've been seeing that going by in my feed, and I've seen that more and more coming across. I think it's called something else, something like that.
That's sounding familiar, and
nutrition.
And I'm not sure. I think it wasn't available in the U.S. for a while, and then I think it's just coming in. So you guys, as you do your baby thing,
we'll be
more. In Europe, there is, by the way.
Huh?
So look to them.
Well, one of the things that we sometimes tend to think and focus more on almost like a reductionist kind of thing, like what are the nutrients that you're missing, or the lack of nutrients and things like that. We tend to focus more on the lack of nutrients as opposed to, oh my God, the abundance of nutrients in plant power. How do you talk to us about how you coach and guide people along this avenue?
Yes. I was just having a conversation with somebody in the grocery store, and I said, I think they were plant-based, and I said, it's interesting to me because some people, the very first thing they say is, oh, I'm cutting this and I'm cutting that. And what I say is plant-based eating, vegan nutrition opens up. I feel like we open the curtains, and most people that are omnivorous or are not, don't come into this world plant-based, it's a limited number. It's like the grain they eat is rice and maybe barley. a few kinds of beans, black beans, pinto beans, a small amount, vegetables. There's maybe 5 or 6. And I say, plant-based eating is so cool because look at all the plethora of grains and beans and then vegetables from, I tell them, we're lucky now because look at all these different international groceries. So it's more than broccoli and carrots. It can be jicama, and it can be taro, and it can be rambutan. And so that's how I approach it. You get more choice when you go to plant-based. You have the opportunity to look at more a variety. So that's how I approach it, is give them more choices. And it's exciting because it's new tastes. And sometimes people with allergies, I don't know if you guys hear this with, oh, I'm allergic to soy, or I'm allergic to corn, whatever it might be, real allergies. And when they start opening up to different foods that they've never had, less chance of allergenic responses.
Well, I've also seen quite a few people that have gone plant-based that have changed to, they've undergone this massive transformation, and then they go back to the foods that were causing them issues, and usually a lot of them don't have allergic reactions. And I've seen this quite a few times where people, may still have one allergic reaction to something, sure. But like I had one client in particular who went plant-based, and she had at least 15, 20 allergies. I mean, she was allergic to everything. The poor thing couldn't, hardly eat anything. She went plant-based, and lo and behold, as she cleaned up her diet, cleaned up her body, all of a sudden now she wasn't allergic to anything except one thing. She was allergic to one type of nut, and that was it. And all her other allergies, symptoms, gone. So, that's a huge one too. So I think, in many cases, a lot of allergic reactions go away because allergic reactions are responses in your body to inflammation and something that is not annoying you in the body. So there's a lot of things that annoy you in the body when you're eating, animal products and processed foods and things like that. So
just to clarify, I think it's a little bit, it's interesting to talk about an allergy, but a true allergy, like an anaphylactic reaction. I don't know whether those can change, but food intolerances.
No.
I have anaphylactic, really?
Yes.
Yes.
Because
yes.
like this one client I'm talking about in particular, like literally she had to have an EpiPen with her at all times because she would have such severe reactions that, some of them could cause her death. And afterwards, after she went plant-based and her body calmed down, and at the end of the result, she was allergic to, afterwards to one nut. That was it.
Wow.
That was it.
And you've seen that too, Laura?
Serious, I'm sorry?
You've seen that too, Laura?
I do. I have seen that. Not tons, but a lot. And I think as we talk about inflammation, and as I love to talk about reducing the acidity in the body and having the alkalinity come, and then of course, yes, we know that what contributes to acidity? Animal products,
Processed foods.
Yeah. And then, as somebody can go towards eating more organic and less pesticide free, so it's all, as we make all those connections and those links to what it is, how we can clean up our diet. And let's say somebody says, I get a lot of this, oh my gosh, am I going to have to stop eating chocolate? Like that's the only thing. No, get some cacao and make an amazing smoothie with all kinds of things. I talk to people about, there are sweet foods, dates and monk fruit, just 2 things. So I talk to people about, it doesn't have to look like you're quote unquote depriving yourself. If somebody says, I want to have a muffin, well, make some great muffins that are not so processed. So
that's one of the things we talk about in our program is recipes and foods. Yeah. And we've got, I'm in the kitchen all the time, adding recipes all the time to our database. And it, yeah, I mean, that's one of the things we teach about is how to cook, how to prepare, to train you for lifelong, because a lot of people are going to have to change things that they were literally raised with. And, you know, and how to cook this way and how to bake this way and how to make muffins that aren't going to make you unhealthy. So let's
Right.
move on to, once you do get pregnant, yay!
Yay.
In the beginning, there's the morning nausea. And have you noticed a difference in vegan pregnancies with nausea, morning, the nausea? And what can you do to recommend help when you do have nausea in pregnancy?
That's one of the things I don't, that and gestational diabetes are two things I really don't notice that veganism makes a difference. And I don't know physiologically, and I don't know, maybe Debra, you can speak to this in a minute, but I can offer some things that can help with nausea. My observation, some of it's genetic. For myself specifically, my mother had no nausea, I had no nausea, but I've had clients that have had it really badly, whether they be vegan or not. But I can say that, I can give them things that can help. I can give them modalities that can help, and I can offer food choices and that can help with the nausea.
So what are some good food choices to help with the nausea?
Right. First of all, staying hydrated, eating smaller meals, and mamas have to experiment. So some moms say saltine crackers, and that sounds really processed. And I say to people, listen, whatever you can keep down, you got to play with that as far as food goes. But I find water-rich foods, so watermelon and cucumber, which are also great to help release some excess fluids, some edema, that helps as well. So you get a double wonderful positive result. And I also say really lemon in the water can help if you don't have issues with your teeth. And you shouldn't be doing that. So that will often help. There's these pregnancy pops. I haven't gotten any Prego pops. Some people swear by them. I have some clients who have told me they love that. Cactus water. So things that replace electrolytes, and it's very person specific and taste specific. So some people love coconut water and some people don't like it. Maple water, some people feel that helps them. I love cactus water. That I don't know why, but that's a thing that works for a lot of folks, and it's not so sweet. So those are some things.
It's interesting that in your experience that you have seen no change in those two conditions, because I have read that when people are plant-based that there actually is less. Well, there's a theory that we actually have this aversion to foods that might be poisonous, which are animal-based foods, and that's why we have this nausea and a reaction to that. But it is sort of it's also that the HCG, the hormone of pregnancy, actually acts directly on the nausea center of the brain. But I had found in the patients that I've taken care of who were plant-based and vegan, I think did not suffer, but I don't have, my N is small, so I don't have that many. One thing that we've been taught that really helps is ginger. And I was wondering if you've used, because ginger chews, ginger tea, just a quarter of a teaspoon of ginger. Ginger is an amazing spice. It can help with headaches and migraines and definitely, and also for nausea. So there are actually all kinds of ginger chews that you can use. And then of course there's B6, vitamin B6. You can take 25 milligrams 3 times a day, and that helps too. And that's, but people can be extremely ill. So this can be very, very serious. I've had patients who had needed to be hospitalized, and it need to be checked out. So if you're suffering from nausea and vomiting, and you need to talk to somebody, because it may be a sign that something is amiss, and it may not be, but it needs to be checked out. There needs things that need to be checked out.
Ladies, we have one question on deck from Shalini Langley, and thank you for joining us today. She says, a lot of people say no to soybeans and tofu. So what are your suggestions? So I'm going to let you ladies take it up, and then we need to wrap it up.
Okay.
You do it. I would just say one thing. I'm just not sure. Maybe Shalini can tell us. Many people say no. What do you mean? Like you shouldn't have it? Because soy is
right. You say no to soybeans. No
no
to soy. No to tofu.
No, soy is extremely health promoting, and 2 whole soy products a day would be extremely healthy for you and your baby and lower the risk of breast cancer for you. And if you could start your child out eating organic whole soy from a very early age, you'll see the most benefit later on in terms of reducing both prostate cancer if it's a man and breast cancer if it's a woman. So no, organic whole soy. And we're not talking about just soy protein bars or soy protein isolate, but really, and not GMO soy and not soybean oil or anything like that. I'm just talking about tofu, tempeh, miso, and soy milk, all from organic soybeans.
And I just want to throw in there that if you don't know how to make soy yogurt, oh my gosh. I mean, that takes it to a new level because you're getting not only the soy, the benefit from that, but you're getting the benefit of the probiotic, but also you're adding something or making something that you can use. I use it as a base for so many creams and sauces and dressings. Oh my God, it really opens up a whole new world and ridiculously easy to make that. So Laura, thank you so much for taking the time.
Thank you.
How can people find you? How can people find you?
So right now they can contact me at Touching Spirit, the number 1. So touchingspirit1@gmail.com. And I'm happy to answer any questions. I am teaching online hypnobirthing and childbirth education. I'm also offering virtual doula support for people as well, and hypnosis pre-pregnancy, postpartum, and during their pregnancy to clear some things and to help with assistance. So thank you, ladies, again.
Oh, wonderful.
For all your help.
Wonderful to talk to you. It's fantastic.
Yes.
I think you're offering amazing services. So I hope people take advantage of you.
Yes.
Well, not in a bad way, but in a good way.
In a good way. Thank you guys for all you do. I'm excited for the baby part. Keep me posted.
Coming soon to a theater near you.
Okay. Cool.
All right. Well, we'll see you back sometime soon.
All right. Sounds good.
Yes, thanks.